My disease is malaria, also known as Plasmodium falciparum, and its name origin is Malaria, from Italian bad air. It's associated with the Greek and Roman, where they associated with the areas that smelled bad because people were infected with the disease, and it was discovered by Charles Louis Alphonse Laveran around 1880s. The definition is an infectious disease caused by a fever, characterized by fever that is caused by a protozoan parasite that invades and infects the red blood cells in the body. It affects body parts are bloodstream, liver, and red blood cells. Basically, what happens: mosquito bites you, the parasite goes from your bloodstream to your liver, and then from then it reproduces and then spreads to your red blood cells. Cause of the disease: the main cause is the Plasmodium parasite, and it's caused by it's carried by the Aphos mosquito, an Anopheles mosquito, and the 5 main types are Plasmodium falciparum, which is the most common and deadliest. Plasmodium vivax has milder symptoms, but it stays longer in the body and can cause relapse, like it can reactivate after a while. Plasmodium ovale is uncommon and can live with it for many years without having any symptoms. Plasmodium malaria, which is very rare, and Plasmodium knowlessly, which is the rarest of them all. There's also diagnosis. There's 6 types of diagnosis. Clinical diagnosis, which is basically you go to a doctor and they check your physical appearance, your symptoms. Microscopic diagnosis, they see it, your blood, they get a drop of your blood and see it under a microscope. Antigen diagnosis, they use immunologic tests to identify the malaria antigen. Molecular diagnosis, it's the parasite's nucleic acids are detected. Serology detects antibodies against the antigen. And drug resistance, basically they use a mixture of drugs to identify growth and then identify the antigen. Some symptoms are fever, chills, sweats, headaches, body aches. You could go to coma, you could pass out, nausea, respiratory problems. How long can somebody live with it? Many years. If it's treated correctly, you can also cure it. If it's very severe, it depends on the severeness. If it's very severe, for a few months maybe, you could probably die of it if you don't treat it correctly. But yeah, how's everyday life affected? Like, person doesn't feel like working, you have headaches, body aches, if you're weak, they don't want to eat, complications. If the malaria symptoms get worse, then the person could have circulatory problems, permanent cerebral damage, and that's it. Because someone can also live the whole life with it if they don't treat it, or they just treat it badly, like it keeps it under control. Medications is atovaquone, chloroquine, doxycycline, mefloquine, and primaquine. They all cause nausea, body damage, body ache, vomiting, and all that stuff. Prevention, you could use bed nets, repellent. You could also avoid staying outside for too long and wear appropriate clothing. Research is done by CDC Malaria Research, and they basically are getting info about how to treat better the disease. And support groups are CDC Foundation, Malaria No More, and Nothing But Nets, and they basically raise funds for poor countries to fight against the disease. Famous people with the disease: Cheryl Cole, X Factor judge; Genghis Khan, he's like a Chinese conqueror; Michael Essien, he's a Chelsea midfielder; Christopher Columbus, an Italian explorer; John F. Kennedy, 35th President of the United States; and Mother Teresa, a Nobel Prize winner.